My name is Leanne Dobrescu. I'm actually the head of operations for Hollard Health, and it's my pleasure to be the person who actually introduces everybody today. So, welcome to our webinar today, one in a series that we've been running for a while now. So, I hope we're getting some serial people who've kept on joining and kept on enjoying it. Today's subject is, I think, one of the more interesting ones that we've allowed so far. So those of you who've been coming know that we really believe wellness goes beyond treatment and diagnosis. We really want to be ensure that you're empowered with knowledge, tools, and compassion to live better every day. That's why we host these webinars, and we create the space for conversations on topics that really matter to your health and well-being, with guidance from our leading professionals, such as Dr. Guy, who we have here today. This month, we're focusing on a subject that touches countless lives, and it's often misunderstood, which is addiction. And it comes in many shapes and forms, from substances like alcohol or nicotine to behaviors like gambling, screen use, food. And while it can be deeply challenging, it's really important to remember addiction is not a moral failing. It's a human experience, and one that deserves empathy, understanding, and support. By talking openly, we hope to destigmatize addiction, create space for healing, and whether it's for yourself or a loved one who is experiencing this type of challenge. We're honored to be joined by Dr. Guy du Plessis, who brings a wealth of expertise and experience to this conversation. Dr. du Plessis will guide us through how to recognize the signs, understand the underlying factors, and most importantly, learn where and how to access support that's available. So let's come to this conversation with open minds and open hearts. Together, we can learn not only how to manage addiction, but how to build healthier, more supportive communities, which is really what we are as we sit here together. So let's get going. Over to you, Doctor, on the signal.
Thank you very much for the introduction, and it's my pleasure to be here today with everyone and talk about this important topic. So let me dive straight in there. So as mentioned, the topic is what is addiction, and how can one assist somebody with an addiction issue. Why speak about addiction? Well, firstly, probably the main reason is that it's quite a common phenomena. So we want to, as it was mentioned, sort of destigmatize it, because it does have a stigma. It's not the type of thing one feels always comfortable openly admitting that one has a substance abuse problem or an alcohol problem or gambling problem, etc. So there's definitely some sort of social stigma around that makes it challenging to firstly admit it and then ask for help. But the reality is most people, if knows somebody that had an issue or is having an issue with a friend, a colleague, or family member, it's a very common phenomena. And also from addiction point of view, you can maybe say that there's two sort of categories that it would fall into: sort of legally sanctioned addictions, if you will, and then illegal substances, sort of street drugs. But a huge portion of addiction, maybe even the majority, is from legal sources, particularly doctors, sort of for pharmacological type of addictions, whether it's tranquilizers or pain medication from doctors. So a large portion of people that use substances that could be classified as addiction actually comes from legal sources. And then there's also, I suppose, addictions that are socially sanctioned, like work addiction, where in certain companies or certain situations that would be seen as a positive thing. But for the individual, it's not positive. There's harm for himself and his family, and maybe even for the company in the long run when it comes to stuff like burnout, etc. So what is addiction? That's a complex question, and there is a lot of different views on that, particularly depending on the view of whether it's from a sort of biological point of view or social point of view or psychological point of view. So there's many different perspectives on addiction. But if one wants to have a simple and sort of straightforward definition of that, one could simply say that addiction is a sort of pathological relationship to a substance or behavior that has got two main characteristics. The one is that there's impaired control, which means the person isn't capable of using the substance or the behavior in the way that they intend to. And that varies in degrees. All addictions isn't something that's just purely out of control. Um, let's say with alcoholism, it can be somebody that just sort of binge drinks on the weekends, but in the week there's no drinking. But in the periods of time that they do drink, there's loss of control. And with other substances as well, which is somebody sort of takes cocaine at parties or just every couple of weekends, just because it's not being used every day, and just because there isn't a physiological dependence, doesn't mean that it wouldn't be seen as addiction. What the second criteria, what would define it as addiction, is the degree of harm that that particular moments in time creates. Um, if somebody is just using alcohol weekends, even if they drink a lot on the weekend, but there isn't great harm, it's not problematic, then that wouldn't necessarily be seen as an addiction. And also with the newer sort of terminology around addiction, it's seen on a continuum of what they call substance use disorder. So it could be mild, moderate, or severe. So to really understand or classify addiction, one needs to look at it from these two lenses: the degree of loss of control and the degree of damages or negative consequences that happens when the person is actually using. The other element around substance use issues is that it's also progressive. So over periods of time, there's less control, there's more consequences. So it's a process. Somebody might have been able to successfully manage substance use or alcohol, for their 20s or 30s, and then by the time they hit their 40s or 50s, becomes more problematic. So part of the issue with that is that identifying addiction, especially when it comes to legal substances like alcohol, makes it more difficult because it's a legally sanctioned substance, where if somebody was using methamphetamine or took or something, then immediately it would be sort of at least from a moral perspective, seen as problematic. But just because something is legal doesn't make it any less sort of risky, or makes it any less of a problem in the context of addiction compared to something that's illegal. So the other two factors that one needs to incorporate in a sort of general view of addiction is how it firstly affects the brain when it comes to reward. So as most people would probably know, addiction obviously affects reward. It makes you feel good. And we designed as human beings to seek out activities that provide us rewards. For instance, the most simplest ones would be food and water. Without food and water, we wouldn't survive. So when we eat something or we drink water, our brain and our body rewards us with pleasant feelings. And that's how, animals are designed like that as well. We seek out rewards that's necessary for our survival, and our body and mind and brain and mind rewards us through often sort of dopamine bursts to say, that was a good thing, do that again. It's good for your survival. Now, the problem with substances is, or even certain behaviors, is that it sort of hijacks that reward system. So your brain and body starts associating the drug or the behavior with, let's call it sort of life um, activities that are normally considered necessary for life, like eating and drinking, and even attachment, etc., with a substance. And that leads to very high levels of craving. So once that sort of system in a person's mind and brain has been hijacked, it becomes more problematic controlling that, because it elicits very, very strong cravings. Um, and the longer that goes on, the less control there is, and the more damages starts piling up. So types of addictions, you could basically see there's two broad classes: substances and behaviors. Most people would be familiar with the various substances, alcohol, and the legal substances. That's quite self-evident. And then you have sort of more milder stuff like tobacco and caffeine. Obviously, one can be addicted to caffeine, but clearly there's a difference between having a heroin addiction and a caffeine addiction. So just because there's some dependency, um, pure dependency, just because you're dependent on something doesn't necessarily make it a problematic addiction. So dependency doesn't equate addiction. Even for people on medication, psychiatric medication, that you can become sort of physically dependent on, just because there's a dependency, uh, which mean you would have to sort of wean off because you'll get withdrawal symptoms, doesn't mean that that is now an addiction and a problem. So one needs to be careful to sort of mix the idea of dependency with addiction. Um, then the other types of addictions that are not so sort of commonly seen as addictions is stuff like gambling disorder. Also now with the internet and online activity becoming more prominent, gaming, um, just general internet activity can become addictive. And also there one needs to,
On the
before
sixth,
one jumps to sort of classifying something as an addiction, one needs to look at it from those two lenses of control and consequences. If somebody spends a lot of time online and it's something they enjoy, it doesn't necessarily mean that they're addicted to that activity. Even gambling, even other types of behavior that could become problematic. There has to be
on the
a
sixth,
perspective of harm. Now, let's say with gambling, um, losing money, let's say losing 1,000 rand, is relative for the person doing that. If somebody is very rich, losing 1,000 rand is not a big consequence. In fact, it's not a consequence at all. It makes no difference to their life. But for somebody that earns 5,000 rand a month, losing 1,000 rand every weekend is a huge consequence. So harm is also relative to the person doing that. It's relative to their particular lifestyle. So it's not a how can I say, a fixed a fixed notion that people that lose more than 5,000 rand a month on gambling are gambling addicts. It entirely depends on your circumstances. The same with substances, and the same with something like alcohol as well. The amount you drink doesn't necessarily equate to addiction. Somebody might drink more than somebody, um, and have much less consequences and have more control than somebody that drinks less and has issues on those two. So one has to see it within the context of people's lives. So what are signs and symptoms of addiction? The most obvious ones are sort of exterior symptoms that one could pick up in somebody's appearance. There can be loss of weight. They can look more disheveled. Their behavior can be different. The sort of memory loss, or sort of unfocusedness, emotional mood swings, irritability, anxiety. So there's these external sort of physical signs on somebody. And then probably the most prominent would be in their actual environment. Let's say crashing the car, or having debt, not paying the bills, house is a mess. So in time, as the control gets less and less of the substance, so the consequences and the damages sort of start piling up to the point where it can become visible to people in the sort of outside world. But just because there's no visible signs doesn't mean somebody isn't there isn't a problem, because the main consequences can also be emotional. And then there's the issue of tolerance and withdrawal, which we just spoke about, the sort of reward system, the dopamine system of the brain being hijacked by that. The more one uses a substance, the more one needs to use it to have the same effect. And that relates to how one builds up tolerance. For instance, with pain medication, even if you take it normally after an operation, within 4 or 5 days, the same pain medication will be less effective. With opioids, for instance, the tolerance raises rapidly. It's like a very steep curve. And then, of course, with substances, particularly in the sort of opioid family, and the benzodiazepines, like Valium, etc. Those two, and also alcohol, those have got a very strong physiological dependency potential. So with, let's say, something like Valium, if you take Valium every day for longer than 3-4 weeks, it's going to start translating into a physical dependency, which means that once you stop it, you have very hectic and severe withdrawal symptoms. The same with opioids. Opioids literally takes about a week. If you take pain medication for 1 week, 24 hours a day, after that week, there'll be quite significant tolerance and quite significant withdrawal. So the two things I would certainly warn people of to be careful of is pain medication, opioids, and benzodiazepines, which also can be sleeping tablets. Those two in particular builds up tolerance and dependency pretty quickly. Alcohol as well. But mostly people don't drink alcohol throughout the day. They'll drink it in the evening. So for most people, it takes a bit longer if they drink a lot, to develop a physical dependency on alcohol. But alcohol has a very high physical dependency potential. If you drink alcohol literally the whole day, 24 hours a day, for about a week, you'll get quite serious withdrawals when you stop. So what's the impact of addiction? We've already discussed how it sort of can look from the outside, these sort of consequences on the person's appearance in their life. But addiction, one can sort of say it's a holistic disease, in the sense that it will eventually affect everything in your life, particularly relationships. Many theories of addiction view addiction as a misguided attempt to form sort of relationships that has reward or sort of value for the person. Addiction is often seen as an alternative way to self-soothe, to make one feel better, that's not reliant on human beings, because humans are untrustworthy in that sense. But it's not easy. It's not easy getting your needs met from other people, in the sense that other people also got their own issues. They can be unreliable, etc. So it takes a lot of effort and work to maintain relationships, to have your needs, your social and emotional needs met through people. It's hard work, absolutely necessary, but hard work. Having your needs met through a substance just requires some money and a dealer's number or a doctor's number or a bottle store. It's a way to change mood, change feeling, soothe yourself from a sort of self-medication perspective that's reliable. You know what you're going to get. So from a relational point of view, one can see how the behavior or the substance sometimes is a substitute for relationships. So one of the first things that will start being eroded is the relationships in the person's life. And eventually that will sort of spread to more logistical and environmental issues like car crashes, etc. But relationships are normally the first thing to I won't say go, but be negatively affected. particularly if somebody's married and has children.
On the
So
sick.
what does one do? Well, that depends, I suppose, on two things. The first thing is the degree of the issue, and the resources available to the person. And I think one thing that's important, particularly for the type of environment that most of the audience will be in, is that all issues with substances or behavior is not addiction. It's not, it doesn't need to be treated like an addiction because it's on a continuum. So the same with medical treatment. I don't want to use sort of cancer as a thing, but any type of medical condition that's on a continuum, there could be sort of mild forms of it, and then more severe forms. And depending on the severity of it, well, maybe let's use cancer. Depending on the severity of a cancer, you have a specific protocol that treats it. You don't, have a big operation and have chemotherapy if there's just a small sort of malignant tumor that can be, cut out without too much disruption to the rest of the system. Or compared to if you have a cancer that's spread throughout the whole body that needs a very, very severe form of intervention. So addiction isn't just something that's on or off. There's a continuum. So many people will have problematic drinking or problematic substance use or problematic relationships with gambling, etc. That doesn't necessarily warrant a full-blown sort of addiction treatment protocol. So to cut a long story short, if there's problematic use, problematic drinking, or problematic behavior, seeing a therapist or reaching out to some sort of community support system can be all the person needs. That can be enough of an intervention for them to modify their behavior. If it's progressed sort of further down the line where there's a lot of loss of control, there's a lot of damages, then the person might need an inpatient program or more supportive programs like AA, Alcoholics Anonymous, Narcotics Anonymous, individual therapy, and like I said, maybe an inpatient program. So it all depends on the degree of the issue, and the degree can be classified, as we mentioned, degree of loss of control and degree of damages and consequences. The more severe those two things are, the more intensive, for lack of a better word, intensive the treatment needs to be. But there's also help available for people that have just got mild issues with that. So I think that's important to know, to find the right intervention relative to the degree of the problem. You don't want to overkill it, and you don't want to have an intervention that's not effective. So the options here: medical detox, in a rehabilitation center. There's individual therapy. There's free support groups like AONA, and then there's obviously individual changes that one can do, maybe with the help of a therapist or coach. They can also change problematic use. But lifestyle changes, doing some exercise if you have a severe drinking problem isn't necessarily going to do much. You need some more intensive intervention. So what does one do if somebody else has a problem, and you're part of the situation, whether it's a family member or, in the audience case, a colleague? I think firstly, as was mentioned in the beginning of the talk, is not to approach addiction as if it's this moral failing, as if it's something that somebody is doing because they're either a bad person or they've got a sort of weak character. That's a very old school way of thinking about addiction. Addiction is not seen anymore as a moral failing. So one needs to address it like you address if somebody has diabetes, or another illness, another sort of more chronic illness. It's an illness like any other illness, and one addresses it as if it's a medical problem. And in many cases, it is a medical problem. If you have an opioid addiction, or addiction to, let's say, Valium, etc., you need a medical intervention. Approach it in a non-judgmental way. Listen with empathy, and encourage to get professional help. There's certainly enough help available on this continuum, from sort of mild intervention, let's say individual therapy, to inpatient treatment. There's a whole continuum of care that somebody could potentially participate in. Yeah, I would say the best thing probably to do for a colleague is to help them find the appropriate level of care, because you yourself, as a colleague, is not capable of necessarily helping them resolve the issue. Some good advice isn't necessarily gonna resolve that. So the best advice, or the best thing one could probably do, is to help them find the right level of care. And that might include some education of oneself, like what is the right level of care? What can they afford? Does the company they work for provide resources, etc.? What is available for them? And this leads us to some of the final slides here. It seems that Hollard Health does provide some support in this way. So you can access psychological support, and even if that's just for a short while, I'm sure the therapist that one deals with can put you in the right direction, move you in the right direction, get the right care that you need. So fortunately, Hollard does provide that as a first step, which is a good thing. And I see also they do the teledoc support. Yeah, so fortunately, you guys that work for Hollard, there is an initial step that you can take if you need help for yourself, or if you need help for a colleague, which is a very useful service to have. And from there, one can decide what the next step is, whether it's more intensive treatment, or simply individual therapy or coaching is enough to change and develop some newer and more healthy adaptive behavior. Yeah, so I think let's end it on there to go through some questions and answers. But I think the last thing I would say, from my personal experience, I've worked in the field a couple of decades now, is that addiction treatment does work. There is a cure for this problem. It's not an uncurable issue. It's not a problem that we don't understand, that we don't know what to do. There is help available, and recovery does actually work. There are millions of people all over the planet that has managed to successfully abstain after having a problem. So treatment does work. The main challenge is finding the right treatment, understanding what the right treatment is, and also the resources to getting the right treatment. Most of you in this company, in your situation, it's unlikely that there are that many that suffer from some very severe addiction. Otherwise, you wouldn't be able to have a job. You wouldn't be able to manage this. So most people in the corporate world, if there's an issue, it's probably in the mild to moderate spectrum, which means there's enough resources, there's enough resilience there to probably change course or change direction with a more milder form of intervention, and for it to successfully address the problem. So in short, there is an answer, there is a solution, and in your case, there is resources available to address it. So approach it like a medical problem. Don't moralize, make it a moral issue, and help somebody or help yourself to get the appropriate care that's required, and then things will be fine. Yeah, so let's end it there. Thank you very much.
Thank you, Doctor. Thank you for your input. The idea here, by the way, is not to give everybody all the answers on addiction. It is a complex topic, but to really alert you to what to look out for and what are the first steps you can take, either for yourself or for a person, a loved one that you think is in this situation. We are open to questions. While people are typing the question, something that came to my mind. We've glanced over the issue of gaming and let's say device addiction. I think a lot of us have children, and we may loosely use the word you're addicted to that device. And maybe you can give us some guidance around, so when do we really need to worry, and when is it just normal child behavior? I think our worry is that it becomes a pattern in their lives.
Yeah, that's a important and interesting question. I think the first perspective one needs to take is to understand the addictive nature of a lot of online activities. In fact, it's not implicitly addictive. A lot of the, because basically, the internet, the way it is today, everything is designed to grab somebody's attention and to make money through them. Because that's how companies design internet activity, is to get your attention and hopefully for you to eventually buy something, or to use your at least to use your data or something. But it's not a neutral space where there's just information that you access. There's intentionality behind a lot of especially with stuff like social media. In fact, a lot of these companies work with addiction specialists and behavioral psychologists to make the activity addictive, like the scrolling of Facebook, etc. That's intentional. It's designed to sort of hijack and reward your dopamine system. So it is addictive by nature, because it's intentionally designed to be addictive. So there with children, I suppose one can ask the same question: how bad is it to give your 5-year-old child alcohol, or a mind-altering substance? Because it is not that dissimilar. It's just a different trigger. The same with sort of gambling. Would it be good for you to teach your child gambling at too much of a young age? So obviously with the internet stuff, one can't avoid that. But I think one needs to be aware of the inherent addictive nature of these platforms, particularly social media, and particularly platforms that are so-called free, like Instagram or TikTok, whatever. They're not free. They're there to make money from your data. That's sort of common knowledge. So I think parents need to be quite vigilant as to the amount of time and the type of platform that their children are exposed to, because the people on the other side of those platforms are there to capture the child's attention and to somehow make money out of that attention, whether it's the data or the child buying something or convincing mommy or daddy to buy something. But it's about making money. It's not there to it's not there to be good for the person. People have other motives. So I think especially at the moment, the way things are designed, parents need to be mindful to know that there's a very difference between different types of online platforms. Some of them are literally, something like TikTok is, it's sort of like the cocaine of the internet, just the way it's designed, that short
quick fix
bursts of dopamine, and that way of focus also really unhealthy for your cognition. The way it sort of short circuits one's cognition. Normally, TV and stuff was designed. You watch a program for half an hour. There's a reward at the end. You sort of have to engage with it for quite a while. TikTok, it's 15 seconds, and then there's the reward, and then there's the reward. So anyway, I don't want to start preaching about it, but I think one just needs to be aware, of the potential danger.
Perfect. Let's move on to another question. So there's a really interesting one here, which is, do mental health disorders lead to substance abuse or behavioral addictions, or does substance abuse lead to mental health disorders, or both?
That's a very good question. It's sort of the chicken or the egg type of question. I would say both. Mental health disorders are what would be called a risk factor to addiction. So something like depression, even something like ADHD, which is debatable whether that's a mental health disorder, but it's certainly an issue people have. So ADHD raises the risk for developing addiction. And so, yes, the answer would be yes, mental health disorders can lead to addiction or at least increase the risk. And then, secondly, using substances, certainly addictively or from an abuse perspective, leads to mental health disorders in and of itself, depression, anxiety. And then once you stop the substance, going through withdrawals is also a mental health crisis, really. There's depression, there's anxiety. So yes, the answer is yes from both sides.
Perfect. So another question is, how do you assist someone who is in denial for being addicted to alcohol? On the
Yeah. Well, that's basically what addiction counselors do most of the time as certainly part of their training, but their job is to work through somebody's what they would call resistance. So one of the let's say, perhaps unfortunate consequences of addiction is what's referred to as denial. Um, because for most people, abusing a substance or using addictively, there has to be a denial for them to continue. Otherwise, there'd be too much sort of cognitive dissonance. You'd be, you would just, nobody likes doing something that you think is bad for you. So you have to convince yourself that there's a good reason for doing that, even though you do know that there's some issues. So there's some minimization and rationalization that's very common. And the further you're on that spectrum, the more sort of severe the rationalization and the denial becomes. So yes, the question is very difficult actually dealing with somebody that is in denial. And it's very difficult for a normal person, if you will, to successfully deal with that. It's something that addiction counselors and therapists are trained to do and is a difficult skill to have. So to cut a long story short, I would say the best thing you could probably do is to refer somebody to a specialist that deals with denial to help the person break through the denial.
The other question is, does genetics have anything to do with addiction?
Yeah, that's a contentious issue. I suppose I can only give my personal view on that. That's a view that some agree on and some don't agree. So that there's no general consensus on that question. My personal view on that is that genetics can play a role in having for somebody to have a predisposition potentially. For instance, let's say you have something like impulsivity can be genetic. So you have more impulsivity than someone else, and then impulsivity is a risk factor for addiction. So there can be certain traits that you have genetically. ADHD has got a strong genetic component. So having ADHD, that makes you prone to addiction. But personally, I don't believe that there's such a thing as a genetic precondition for addiction. That is genetic as such. Addiction is too much of a complex behavior to have a genetic programming for it. Sort of saying like, do I have a genetic disposition for liking classical music? No, you can't have that, but you can have a genetic predisposition for heightened aesthetics or artistic flair for that matter, which influences your music choice. So indirectly there can be, but there's no clear, nobody is born with, okay, you are going to become an addict because you have this genetic predisposition. That's not the case.
There's another question here, which is, how do we access teledoc in Nairobi in Kenya? So our telehealth services are available on the app. If you go into my services section of your app or the portal, you will see one of the services there is teledoc. If you click on the teledoc, you can book and request an appointment with telehealth. They come back to you within 15 minutes to confirm a time. It's a great service. There's also a previous webinar that we did. If you look on the Hollard Health website, there is a segment for webinars, and there is a full recording on the telehealth services and how to access them and what's available there. So I encourage you to have a look at that. There's a question here that comes, can we consider addiction a disease? And then the question is why or why not? I think you have covered it, but maybe just it's worth reminding people.
Yeah, sure. Also a contentious, good question. I wouldn't be able to answer that within the time I have. It's a very complex debate. But if I had to risk giving a short answer, I would say yes and no. Yes, in the fact that it replicates things that could be considered a disease in the sense that it's a symptom, that there's symptoms and sort of problem, there's symptoms and consequences, etc. And then no, in the sense that it doesn't fulfill all the criteria of a disease because the impulse behind addiction, the way that I would explain it, is the impulse behind addiction is not pathological. There's nothing wrong with the desire to feel good. There's nothing wrong with the desire to elevate your mood. There's nothing wrong with when you're feeling lonely or depressed to want to feel better. So in that way, the impulse behind addiction, which I often articulate to have a simple articulation, it's a misguided method to have needs met. It's a misguided way of doing something, but the impulse behind it, wanting to have your needs met, is not pathological. So one could say that the impulse behind addiction is not a disease. That's a normal human craving, a normal human way of being, is to have our needs met. The difference between addiction is that people that have become addicted have found a method that certainly initially worked very well. Like, let's say you're depressed, drinking alcohol works really well initially, but over time, it's not going to work well for depression. So yes, it looks like a disease from the outside, but I don't think one can call it the whole thing a disease, because there's nothing wrong with wanting to feel good and have your needs met. That's not pathological. It's just the method, the vehicle is problematic.
Yeah, and obviously the long-term effects on your health thereafter, physical and mental. So, yep.
Yeah.
And then what kind of support can one offer to someone dealing with addiction?
It depends who it is, because obviously working with a close family member would be different to dealing with a colleague. But I think the thing to understand is that one's help is limited, in the sense that if somebody has been diagnosed with a sort of full-blown addiction, full-blown substance use disorder, it is not an easy condition to treat. It is a highly specialized, let's call it, medical condition, and psychological condition, and spiritual condition, and social condition, that requires experts to treat successfully, in the same way that if you need brain surgery, so the best thing one could probably do for somebody is to help them in a non-judgmental, non-shaming way get the right support that is available for their resources. That's the problem as well. Everyone can't afford inpatient treatment or have the time for that. The best thing one could probably do for somebody is to assist them from a logistical point of view and emotional point of view, and finding the appropriate level of care that they require. But as a friend or a family member, just speaking to somebody and thinking that that's going to resolve their addiction because you're supportive of them might be a bit misguided, because it's a bit more difficult condition to treat than sort of good advice or just giving support.
So we have another question here, which is getting a headache after not taking tea or coffee for some hours an addiction? What is the solution?
Yeah, I think there one needs to be careful of using the word addiction so broadly that it loses all meaning, you know. Um, yes, one could say, you know, if you drink, I mean, I'm certainly addicted to coffee. You know, if I don't drink coffee every morning, then I'm going to sort of know it. But is that an addiction? You know, is that something to call addiction? I would say no. I would say that is more of a physical dependence, and physical dependence in and of itself is not a bad thing. We physically dependent on oxygen. We physically dependent on food. There's a lot of things that we dependent on. But just because there's a dependency, somebody might be physically dependent on, let's say, antidepressants because they went through the thing is. But just because they're physically dependent doesn't mean they're an addict, that's an addiction, a bad thing. So physical dependence or even tolerance, a lot of people on chronic medication, a lot of people on psychiatric medication, just because they're on that, and just because if they stop that, there's some withdrawal. I think one needs to be careful to call that an addiction. I certainly won't, because then the word addiction becomes so broad that it loses all like real meaning. So to cut a long story short, I would say one needs to reserve the term or the construct for addiction for something that is really problematic and really damaging, and not spread it out too thin. Otherwise, it just loses any type of meaning, really.
There's a question about, can you reach out to a psychologist and tell a doc? Yes, you can. Does it help going to rehab multiple times on the sick?
Yeah, well, hopefully one wouldn't need to go multiple times if one implements the suggestions in the rehab. So if you do have to go to rehab, then if one is, I'm going to say, if one is willing and motivated, then I would say one doesn't need multiple times. You can get it right. You can get it right in the beginning. But some people do need multiple times. It takes a while for, let's say, for it to sink in. But it's not a thing like a massage. You know, if you go for one massage, it's good for you. If you go for massage every day, it's better for you. You know, it's like a cumulative thing. Or if you jog every day, it gets better for you than just jogging once a week. It's not like that in that way. So just because you go multiple times doesn't mean it's going to work any better. Uh, it depends on your level of motivation. Some people can go to rehab once a year, and it's not going to do anything. So it entirely depends on somebody's willingness and their sort of cooperation for how effective it is. Quantity is going to make it more or less effective. Let's put it that way.
I think adding on to that question, the next question that comes through is, how can one help or approach to take when a loved one remains in a cycle of accepting to get into professional treatment center, but they continue to relapse, even after very intentional and costly treatment? How do you walk the fine line between not being judgmental, but still feeling like it's now enabling them?
Yeah, that's a very good question and not an easy question to answer. You know, I think there's a real danger, how can I say, generic answers like that. You sort of like notions of tough love. You know, if somebody is gone to rehab and they're not getting it, you need to cut yourself off. You need to do that. You need to do that. I don't think there's a right answer or wrong answer for how one approaches it. I think each situation needs to be judged on their own merit. Some people take longer to clean up. Some people need several treatments, but it's virtually impossible for me or anybody else on the outside, even if I work with a client. It's impossible for me to know exactly. Let's use the phrase of when the penny drops. It's impossible for me to know when that moment is when they actually sort of become open and become willing for the process to unfold. It could be today, it could be next week, it could be in a month's time. So cutting yourself off, you know, and just saying, I don't want to do anything because I'm just enabling, could be problematic because the person might have sort of become willing or become more open the next week or the next day. So you sort of walk away too soon. That's from that perspective. And the other perspective is enabling somebody, where you're enabling them to keep on using by giving them money or supporting their using. But, there, once again, it's a fine line. When is it enabling and when is it support? I can't give just a general objective answer to that. My personal view is one should certainly err more on the side of, I'd
On the
rather enable too much than cut off too quickly. Let's put it that way. It's a very fine line,
on the
not an easy thing to answer.
And I think everybody would have a high level of empathy for anybody having to live with and manage somebody who is an addict, because I think that takes its own strain.
Yeah.
So I think one of the things we'd also encourage anybody who is coping with that to also seek support for themselves as well.
Absolutely.
That put oxygen on your own face first really
Yeah.
really makes a difference for you to manage the situation as well.
Yeah, very important point that I haven't really touched on much is that the support that the partner or the other person needs in dealing with somebody, because that in and of itself, it can be more traumatic dealing with the addict than the addiction is for the addict themselves. So there is support. There's places like NARA and there's Codependence Anonymous. So there's a lot of free peer support groups that people can join online that provide support for the partner of the addict. So I think that's an important point that you raised. Thank you.
On the sick, if that does wrap it up, I want to say thank you to everybody for joining this brave conversation. The webinars are all available on our website. So the ones we've done before are there. And we encourage you to come to our next webinar as well, which will be in a month's time on the 16th. And the topic is going to be around malaria awareness. I know even if we live in high malaria areas and countries and we think we know everything about it, every time I hear about it, I still learn something new. So please do join us for the next topic. And we still have November and December topics coming as well. So we've got some interesting topics coming through to the end of the year. So watch out for the invitations and make sure you join and enjoy the content. And thank you for taking the time out of your day to be here and to take on some information from us. I wish you all a beautiful afternoon going forward.
Thank you, and my pleasure to be here with you today.
And thank you, Doctor. Thank you for joining us. Thank you very much.
Sure. Thank you.